name is Sierra, the CEO and founder of Elite Precision Consulting. We're the ones that have put this great summit together to help serve those who are essentially all over the world in healthcare, making an impact, whether on the clinical side or technical side. So I'm going to go ahead and introduce our next speaker. I feel like I'm going to mispronounce the name, but Fikriansyah, if I say it the right way, I hope so. He's coming from Indonesia, and I just love his energy. You know, I'm a very big energy person, so I just love his energy. And I'm just so grateful for him today to be sharing with us some information. He's based out of Indonesia, and I'm just very, 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 very excited. I will have him go over everything that he has, but please welcome Fikriansyah. If I'm saying it right, I'm so sorry.
Totally right. Definitely right.
Okay, great.
Got
great,
it
great.
done.
All right, thank you so much.
Thank you very much. And I heard you pronounce your own name. It's very insensitive of me to ask you back how to pronounce your name. So it's Sierra.
Yes, Sierra.
Sierra.
Yes.
So I'd like
yes.
to greatly appreciate for the invitation for me to have this stage for it's 7 p.m. here in Indonesia for tonight. So, but for everyone else, it's good morning, good afternoon, and good evening, wherever you are. It's such a big honor for me to speak on this third sessions of the Global Healthcare Summit with Sierra, like very well done, organized everything. And I saw like a really spectacular lineup of speakers that I really love to hear everything from them. And it's just really great that Sierra will share all the recording as well in YouTube and other platforms. So I'll try to share my screen. Can you enable me to share my screen, Sierra? I'm going to share more about what's been happening here in Indonesia, especially on our healthcare system transformations. So at least there will be 6 main topics. If you can allow me to share my screen.
Yeah, 1 second. You should be able to.
Yeah, not yet. It says host still disabled. If you can enable that, yeah.
Oh,
so,
no. Sorry. Okay.
It's all right.
Okay.
If
not, you can send it to me and I'll share it while you're speaking. That's fine too. I apologize.
I'm gonna try.
I may have changed my
email it to you right now.
Okay, perfect. Sorry about that.
No worries. While I'm doing this, I'll do a quick introduction as well. So my name is Fikriansyah. You can call me Fikri for short. I'm a medical device reviewer here at the Ministry of Health of Indonesia. So what I'm actually doing is I do the review, all the documents for safety, efficacy, and quality for every medical devices that want to enter the market in Indonesia. So I'm also part of this initiative called Global Harmonization Working Party, as well as the ASEAN Medical Device Committee, where we're trying to harmonize every technical barrier to trade. So if you want to import or export your medical devices, it'll be easier if you have a harmonized regulations between countries. So that's what I'm part of the global health kind of efforts that we are trying to do at the moment. So Sierra, I just sent it to your, let's call Sierra email. Okay. So that's the PDF versions of the PowerPoint slides.
Okay, perfect.
No worries. So I just graduated from University of Melbourne, December 2021. So I did my Master of Public Health during the COVID years. So that was a really interesting time to learn about global health leaders in action, like how they fight the virus while trying not to fight each other, because you know how every country have their own sovereignty and trying to distribute the vaccines and how to distribute even like masks and everything without having that, you know, ego and selfishness just to keep it for themselves and stuff like that we discussed in the class. And after I graduated December 2021, the Minister of Health of Indonesia himself called me and asked me to join his team. So that's the main issues, the main topic that I'm going to share tonight about the health system transformations that we developed here in Indonesia after, especially the lesson learned from COVID-19. So the 6 main pillars. Did you receive the email, Sarah?
Yes, I did. And I don't even know why it's saying I can't share. I was sharing earlier. I apologize. What I will do is if it's okay with you, I'll put this on our website, and I'll also put it in the chat if that's okay with you. That way people can follow along. Or
Sure.
if
Do you know Ahmad here? Ahmad is the host for this meeting at the moment. If Ahmad can change the setting and help us
okay.
to enable Ahmad do the recording as well.
Okay.
If Ahmad can help to change the setting and allow me to share the screen, because it's really a jam-packed
Yeah,
topic. Because I
So
plan to skip some
yeah,
because, but it's really great if everyone can read through as well. So the
yeah,
six
yeah,
main
yeah.
pillars, the health system transformations that Indonesia trying to do at least until next year, 2024, it's really based on the WHO public health building blocks. So we have the first and second one is on the healthcare itself. So we have primary healthcare and secondary healthcare. The third one is especially after COVID, how we found out that Indonesia is not that resilient on facing any crisis. We really still have this big dependency on other countries, especially like for medical devices. 95% of them is like imported from other countries. So that's why what we're trying to do is creating this health resilience, sustainability. We want to boost our local manufacturers. That's number 3, that really close to my daily job. And then number 4 is on health financing, and number 5 is health resources. Sorry if I messed it up between 4 and 5, between health financing and health resources, including the clinicians and doctors and nurses. And number 5 is on health technology for the biotech.
Great.
All right.
I'm sorry. I think he's maybe not responding. I sent him a quick message as well to give us back the post, right? So just bear with us. I'm sorry. It doesn't.
No, that's all right. I'll
Okay.
try to share the documents here on the chat. If it's possible, let me try.
And Ahmad, again, from Claim, if you can hear us, if you can give myself or Fikriansyah, I'm sorry if I say it wrong.
Fikri of it.
Fikri. Okay, great. If you can give one of us back the host rights, that would be great. That way we can be able to share the screen. So that message is to co-founder of Claim. Ahmad, if you can do that, that would be fantastic.
Okay, I'll continue. So the first pillar of the health system transformations that we are trying to do is the primary healthcare, meaning that we have 37 provinces at the moment in Indonesia, and each of the provinces have their own autonomy, how they deal with their healthcare, because they have their own governor, they have their own regencies, that mayors and everything, and each of the regency also have their own primary healthcare clinic. So that's the first place. Whenever our people get sick or they need like treatment or any informations, they will go to the clinicians at the primary healthcare clinic first. So we want to create this big network. We want to have, we want to make sure that every regency, every cities have their own primary healthcare clinic, because at the moment the distribution is not that equal. There's also have issue with inequity, because Indonesia, we are the largest archipelago in the world. We have more than 17,000 islands at the moment. If the climate change keeps happening, that number is going to reduce because some island might be below the sea level. So it's really important how we utilize digital technologies and everything to connect between those islands, especially the rural and remote area. And we want to make sure everyone get access to healthcare. So that's the first pillar of health system transformations that we are trying to do with the primary healthcare clinic. After that, we go to the referral system. So if the primary healthcare clinic cannot deal with one of 2 treatment, the patients will go to the referral hospital. That's the secondary healthcares that we are trying to improve as well in Indonesia. The Minister of Health at the moment is the first Minister of Health since the beginning that not having any medical background. So he was a banker for 30 years. So it is very shocking at first, because it was always a medical doctors as a Minister of Health, but now because of COVID, because of the crisis, our president at the moment give mandates to him deal with this crisis with the COVID-19. Sierra, I think you're the host now. Can you enable the screen sharing? Or if you can share my slide. I am the host as well. Let me make you co-host. All right, I'll share my screen. All right, can everyone see my screen?
Yes, perfect.
Wonderful.
Thank you.
Feel free to write your questions or anything in the chat box, or just add me on LinkedIn or Instagram or anywhere else, and I'm really happy to answer your questions. And even I'm really open for any arrangement or cooperations that is really possible, that if you want to do your business in healthcare Indonesia. So I mentions like it is really important how the president mandate our new Minister of Health to rapidly execute vaccination, especially for COVID-19 vaccination, which he done really well. I think as the largest Muslim populations in the world, Indonesia have usually issues with halal or haram vaccine. So people usually will ask what is the content of the vaccines. But for COVID-19, the Minister of Health and the team really done really well how to communicate with the people, do the really strong health promotions. And now we have more than 80% of our people already get second dose. Now we are aiming for the booster shot for the COVID-19. And overcome the pandemic is the second mandate of the president, as well as the third one is to do the health system transformations that I'll be more talking on this third mandates more during these presentations, because compared to other countries, especially the countries that having issues with elder populations, but Indonesia will have the peak of our productive age populations in 2030, where 68% of our people will be during their productive age, instead of other countries facing issues with a lot of elders that need to be taken care of. But this is not enough if we just, like being grateful, we have this 68%, but we need to do something with these people. We need to have people that is capable and with the great qualities, because human resources development is a top priority for growth. And I think 2017, there's this survey that says that in average, the tallest the tallest person in the world is from Netherlands, but the shortest one is from Indonesia, which is not good, because meaning that we have this stunted growth, we have issue with stunting. A lot of our people, especially in the rural and remote area, having issues with access to nutrition, and a lot of like pregnant mothers have no idea how to give a proper nutrition for their kids. That's why that's also the major issues with Indonesia at the moment. All right, I believe Sierra will share this slide with you as well, so you can have like more detailed looks on the graph. But this is the benchmarking, how we do the comparisons between the life expectancy as well as the healthcare spending, healthcare expenditure. If you can see on when we combine everything together, US have 78.5 life expectancy, but they have to spend a lot of money for that. But we compare with 77.7 years in Cuba, but they only spend like almost 10% compared to the US. But it will be totally different. It's not really apple to apple, but we're really aiming in Indonesia how to optimize our healthcare expenditure per capita, but also have the better outcome to increase the life expectancy of the people. So each of us have a very important, and it is, I want to say, it's really urgent contributions needed from everyone, because especially after COVID, we believe that nobody is safe, nobody is healthy until everyone is. So it's not only about Indonesian people, but more like global. But that's why I'm really appreciate how Sierra and the team organized this Global Healthcare Summit. So this is the sixth pillar. If you can see, the first one, I already mentioned some of it in primary care transformation. So education, prevention, including secondary preventions, where we want to add more routine immunizations, and then including screening for antenatal care, for maternal and baby health, and improving the capacity and capability of each puskesmas. Puskesmas is the primary healthcare clinic. And then the secondary care transformation is how to increase the access and the quality of each hospital. We want to build more hospital on each provinces. The third one is the one that really close to my heart, resilience on pharma and medical devices sector. as well as the strengthening for emergency response resilience. And then 4th is health financing, 5 health talent, and then 6 health technology transformations. I'll try to make it as short as possible because it's only 10 minutes left, I believe. So the first transformations, we have 514 districts with 7,230 sub-districts, where we try to connect all of this from home visit to posyandu activities, meaning that we have health cadres that will go to their home, and then the other side as well, like the patient can go to these health cadres and then they will bring them to the primary health clinic or the puskesmas before they go to the hospital. And we also want to increase the public health laboratories that are available at the moment, because at the moment it's really scattered. There's no integration between them. It's really each individual laboratories they're doing business as usual. So we need to transform them and do these connections that will work really well if everyone work in synergy. I mentioned about improving, adding another antigens on the routine immunizations. So if any of you that's really interesting on doing business on vaccines, this is also like one of the big chance to come to Indonesia, because at the moment the government's still looking the better vaccines with the better affordability, so we can improve the availability of this vaccine as well. And we will expand the early detections by improve more screening, starting from baby antenatal care, so pregnancy checks. Everyone will get screened, so it will be better treatment they will receive, because usually even like pregnant mother have no idea if they have like specific treatment if they need based on their conditions. So I mentioned about the role of the cadres as well as agents and activists for the community. So co-design of every program is really important. I learned that on public health, how you cannot have one policy that fits everyone. So you need to have a very personalized policies, and it will design like really specific for that region, for that area, for that people, and it must be like culturally sensitive, where you can't really use the same language to everyone. So it's really important you choose the cadres that can help you to leverage and disseminate these informations. So we strengthen the campaigns and movement as well, use a lot of social media and community leaders, even including TikTok and Facebook. So it's really important how we speak the language of our people, not only like giving one way of interactions. On the secondary care transformations, we want to improve the access and the quality of each hospital that we're having right now. So I believe this is one of the example how the government wants to create a national heart care transformations, because it's a very long, even 1 year waiting time period just to get your open heart surgery. So it's really devastating how to see people just pass away because they have to wait that long time period. So that's why the government tried to connect each hospital, and they must capable to do the cath lab and open heart surgery. So it will reduce the waiting period for the people that need this kind of surgery. Okay. This is the goal in 2027. How we can have this 100% project done to build the hospital in each province that capable to do the cath lab and open heart surgeries. So for the health system resilience, we have at least 3 main commodities, including vaccine, pharmaceutical, and medical devices. And we plan to have this emergency response healthcare worker that are registered and trained. So whenever we deal with another crisis, so we already have this reserve of healthcare worker. So for vaccines, you can see this roadmap. We want to master more, especially like novel technologies. As you can see, the viral vector and nucleic acid-based technologies, especially during COVID, you can see the development and introduction of mRNA vaccines to the people, and we received a lot of good improvement, especially fighting the pandemic. And for pharmaceutical, we want to we can produce our own medicines, but most of the API, the active pharmaceutical ingredients, still imported, especially from China and India. So during COVID, that's also one of the main issues. What happened if they block the supply chain? So we want to improve our own capability on producing our own API as well. And for medical devices, it's almost similar with the API. We want to have the technology how to produce the one that we really need by volume and also by value. I have the list that I can show you later on. So this is the vaccines that I mentioned earlier, including the 14 antigens that will be added as the routine immunization, and the two new technologies on viral vector base and nucleic acid base. So the government already have some discussion with Moderna as well as with the BioNTech, how they can cooperate with the government of Indonesia. And this is the API. I think 4 already there in Indonesia. We already able to produce paracetamol, clopidogrel, omeprazole, and atorvastatin. So there are still other API that need improvement there in terms of local manufacturing. This is the medical devices. The one in the yellow highlight is we have the manufacturing, but it doesn't meet the capacity yet. So we still need more improvement on that. The one with the red font is the one that we don't have any technology to produce it by ourselves yet. So it's really the high-tech medical devices, including CT scan, MRI, and endoscope and accessories. But other than that, we have a lot of cooperation as well with other companies, including from Japan and then the US as well as German, how they have their manufacturer here in Indonesia, and it can help them not only to sell it in the Indonesian market, but as well as in the Southeast Asia market. So this is the policy that government trying to help with the local manufacturing. We facilitate the clinical trial. We create the task force and facilitate any testing and calibrations. So there will be like subsidies from the government, tax holidays and stuff like that. That will be make it easier and improve the ease of doing business for any manufacturers that want to set up their local facility in Indonesia. This is the one that I mentioned about reserve health personnel. So anytime if there are any crisis, they'll be standby and ready on call. Even like when the monkeypox issue is coming, they already stand guard ready there. And then it's really amazing how we might seems to learn a lot from COVID, but there's still some issues on the vaccine itself, how to get these monkeypox vaccines just in time before like any other new cases increasing in Indonesia. On the 4th pillar on the health financings, there are several accelerations that we are doing. So we changed from the T-2, T-2 meaning that we usually only do the national health account every 2 years. Now we are doing it every year. So it'll be like evidence-based that we are using before we create or improve or revise any policies that related to our health expenditure. And then we maintain our universal health coverage, or JKN, by doing utilization reviews and tariff adjustment, so people can make sure if they want to get treated, they will have minimum or even zero out-of-pocket spending. And increasing the promotive and preventive benefits as well, because this is also related to the addition of the immunization and pregnancy checkup that I mentioned on the 1st pillar. This is almost similar with I mentioned earlier. For medical device number 6 is really related as well, because with the new technologies coming in, so health technology assessment is really important as well. But this is still under discussions how you can have differentiations between HTA for pharma and HTA for medical devices. So I think this is for another topic that we can discuss more on the health technology assessment. For the 5th pillar on human health resources, we still under the WHO standard. So it's only 0.68 doctor per 1,000 inhabitants. Meanwhile, in Asia, average is 1.2 and OECD average is already 3.2. So there's still a lot of homework to do, how to make sure everyone can get treated with this proportional number of the doctors. So we want to increase number of healthcare workers by adding more study program that include 9 priority diseases. And we're creating this system of academic health system between the Ministry of Education and Ministry of Health. They're creating like academic hospital where more students can learn and become a doctor there, and evenly distributed, because if you see that Jakarta and Java Island is the one where everyone is jam-packed there. That's the issues as well with the traffic here in Jakarta. So we want to evenly distribute the healthcare workers and invite those that already graduated overseas, so our diaspora out there that can help Indonesia and willing to come and located with several other hospitals that are available and in need of specialists. For health technology, this one is really interesting as well, because now we have the one health super app for every Indonesian citizen. We just introduced our electronic medical record for every patient, and all the data will be integrated there. And there will be introduction as well for telemedicine. This has been really successful in Indonesia, especially during COVID, where every patient with positive result have to stay at home, so they can go to any pharmacy or the hospital. So they will be get a WhatsApp message from government to ensure they stay at home for 14 days at that time, and then there will be someone came to your house, put the medicine in front of your door, and so you can just do it, the communication with WhatsApp. So we get support from WhatsApp as well at that time. So I believe this is something that we want to improve as well for any other utilizations for treatment if someone need a home care. Another thing that really interesting as well is on precision medicine. We just introduced the Biomedical Genome-Based Science Initiative, or BGSI, where now we have at least 6 priority diseases that we will try to get more samples of the people from 6 different hospitals, and then the sample will be saved in biobank, and then we will do the sequence, full sequencing on their DNA, multiomics sequencing of the DNA as well. So then we can change that, we translate that into more preventive and treatment when we discuss with the people. So the major issue and major challenge in here as well, how to do the genomic sequencing with the consent of the people. So ethics is the number one, as well as the material transfer, because we have several donors and partners as well. So this is really only possible with PPP. So public-private partnership is number one on implementing this initiative as well. So we will change the way we work. So the internal transformation as well, because I think some of you might be familiar with how some countries have like issues with the corrupt government, how like big project will be like having more issues with corruptions and everything. So internal transformations, how the way of work of the Ministry of Health itself must be transformed as well. So now we with these 6 pillars, we change the KPI of our government officers as well. It will have more performance benefit, regular monitoring will be done, increase our work speed, so there will be less and less bureaucracy. And then there will be more value approach there, and the digitalization of every documents that are needed. So because we have this large archipelago, no one needs to come to Ministry of Health anymore, so they can just do it by system, e-government already in place. So it's really, I'm really optimistic about the future of healthcare in Indonesia. But again, we can't do this alone. We need everyone's help, because it's really about how we create this better world, not only better Indonesia per se. So together we can build a stronger and healthier Indonesia and healthier world. I'll give the screen back to Sierra. Thank you very much for listening for everyone. I'm happy to answer the question.
Wow, I love that. It was so much information that you presented, and I love it. You know, one of the questions that that I had, and actually somebody else had, was, what do you believe is the most important need right now that you have? Meaning, we're here on this global environment, you know, there's people from all over the world, you know, that are joining. What do you believe is the kind of the highest priority, that first step? Is it more human resources, you know, more qualified clinicians? Is it more technology? Is it bringing in more DME and equipment, diagnostics? Is it getting more vaccines? I mean, it's because it's so many great things that you guys are doing. And I would love to get your thoughts on, what do you think is kind of the top priorities? Mm-hmm.
Yeah. So I asked this as well to our minister, and the answer is really shocking me, that this is it, the 6 priorities. So you can't just start with one, it all must start together. It is really parallel, everything have to go in one. But if you really push me to answer, so the top 3 will be the first 3. So primary, secondary healthcare transformations, as well as the health resilience. So if we have like a very good connections between the primary healthcare clinic and then the secondary healthcare clinic, but again, it's really connected to the health resources and health financing, as well as the vaccines and treatment. So everything must go together.
Got it. Got it. Awesome. Well, I think this has been great. It looks like we have another question. How does patients identify themselves? Do you have digital ID with the chip? Is one of the questions.
Yes, we do have the digital ID, so everyone have their own unique number for the national IDs. It got a chip at the moment, but now that they plan to make sure everyone also have the super app, so everyone can access their electronic medical records, and then it will be like have one app that is also integrated whenever you check into every places. So like every country have their own like COVID-19 check-in app. Now they utilize the same app for COVID-19, but also for other diseases. So you can check your vaccination informations there. You can check your other healthcare data, and hopefully in the future, if really possible, now with the wearable devices, we want to connect that with, let's say, Samsung Health or like Apple Health. Whenever like people do their jogging and they improve their steps, now they can also check it in this app.
Wow. Wow. That's awesome. That is great. Thank you so much. I
Thank you,
really
Sarah.
enjoyed